Experts Speak on Eating Disorders by Audrey Boyce. Eating disorders are a prevalent epidemic affecting men and women alike. Sadly, individuals with eating disorders are becoming younger and younger. The topic of eating disorders is one that until recently was a very sensitive subject and considered too shameful to be brought into the open. Bringing to light this taboo subject is something that is crucial and necessary so that this terrible disorder can be treated properly. Challenges and concerns regarding eating disorders. While eating disorders are not something new, there seems to be a recent influx of diagnoses. What has caused this recent influx of eating disorders? At what ages are eating disorders becoming more prevalent? And how can mental health professionals help head off this challenge before it claims more victims? Introducing our experts. Expert number 1, Patricia Preston. Patricia is a licensed professional counselor for a private practice, and she works in a behavioral health case management program. Before taking her current position, Patricia worked as an admissions director for an acute psychiatric hospital. Sue Birdsong, expert number 2. Sue currently works in a private practice as well as an eating disorder clinic. Her passion for counseling and social work is working with clients with eating disorders and helping them to find their road to recovery. Expert number 1, Patricia Preston. Patricia deals extensively with patients suffering from a wide variety of eating disorders. Patricia has seen firsthand the benefit that evidence-based psychological research has provided for treatment options. What might work for one patient with anorexia nervosa might not work for someone with binge eating disorder. Due to the prevalence of Patricia's patients being younger in age, there have been great recent studies that focus on child and adolescent eating disorders and treatments. Patricia recommends an article by Norris et al. Entitled "The Canadian Eating Disorder Program Survey," exploring extensive treatment programs for youth with eating disorders. She mentions that this explores new treatments to deal with this serious disorder. A treatment center for eating disorders that Patricia has often recommended to her patients that need more intensive therapy is the Remuda Ranch, located in Arizona. For more than 20 years, this facility has offered women, teens, and children an all-encompassing treatment program that sets them up with the useful foundation to continue their outpatient treatment back home with their referring therapist. To learn more about this treatment center, visit www.remudaranch.com. Expert number 2, Sue Birdsong. Sue has worked intensively with eating disorder centers and believes that practice-based evidence is far more valuable to her patients than a research study of randomized groups. Although evidence-based research is an important aspect to the psychological field, she finds that her patients benefit more from her successful treatment methods than from a new treatment theory. Sue employs family-based treatments for her eating disorder patients. In an article entitled "I Know I Can Help You: Parental Self-Efficacy Predicts Adolescent Outcomes in Family-Based Therapy for Eating Disorders," the author points out that this method of family-based treatment is regarded as the most effective treatment modality for combating eating disorders. A website that Sue recommends, www.feast.org, is a website that is for families empowered in supporting treatment of eating disorders that provides helpful, resourceful information for parents and families of individuals with eating disorders. Comparing and contrasting the experts. While expert number 1 believes in an evidence-based psychological research program utilizing new treatments as well as treatment centers, and expert number 2 ascribes to a practice-based evidence practice with family-based treatments and empowering the family through support and resources, they both agree that treatment of eating disorders is absolutely necessary for recovery. References discussed in this presentation